Hi everyone, welcome back to my channel. I remain Dr. Adazion at OBGYN Talks with Dr. Adazion. Today we'll be talking about vaginal discharge. Most women know what I'm talking about. Vaginal discharge can be normal, it can be abnormal. It can be a pointer to something abnormal in a woman reproductive tract as well. Vaginal discharge is a secretion from the duct of the genital glands. These glands include the Bartholin's glands, the one that helps in lubrication during sexual intercourse, the sebaceous and sweat glands, the cervical mucus secretions as well contribute to vaginal discharge, the endometrial secretion as well, even the vaginal epithelial secretion, the vaginal wall itself, the secretions that come from the vaginal wall contribute to the vaginal discharge. And now, the microorganism and their products of metabolism also contribute to vaginal discharge. Vaginal discharge can occur in a child, even a newborn baby. It can occur in a newborn baby, it can occur in a reproductive woman, it can occur in a post-menopausal woman. It can be pathological, it can be physiological. In most cases for reproductive women, they are mostly physiological. Vaginal discharge in a woman that is of reproductive age is usually acidic, less than 4.5. And for infancy and postmenopausal women, they are usually about the pH is usually about 7.0, mostly basic. So the effect of estrogen contributes to the consistency, the type, the type of vaginal discharge, the consistency, and the composition depends on the age of the patient and the hormonal status of that patient, or whether there is presence of pathology or not. Hormonal environment contributes to the type and consistency of vaginal discharge also, as I've said. Now, estrogen is mostly involved in the type of vaginal discharge that a reproductive woman sees. Other things that can cause vaginal discharge that are physiological, we'll talk about ovulation, pregnancy, but for in a child or someone that's experiencing abnormal vaginal discharge, there are a lot of things that can cause it. And commonest among children is foreign body in the vagina. This can irritate the vagina and cause vaginal discharge. When you see a vaginal discharge in a newborn baby, in an infant, it sometimes should not be a source of worry, because for a child, a newborn baby, inside the uterus, they are exposed to increased estrogen in the mother, and so the uterus of that baby grows like that of the mother or of an adult because of the presence of estrogen. So when the baby is born, there is withdrawal of that estrogen. The uterus is no more supported, and what it does is that it sheds in a bloody vaginal discharge, and sometimes the parents become worried. So it shouldn't be a source of worry. If we see this type, we have to encourage the woman and reassure her that everything will be fine. We explain to her what is happening, because the uterus of the baby is becoming withdrawn from the rich estrogen environment that it was exposed to before. Then for the girl child, the vulva and the vagina are usually well estrogenized, just like I've said, because of the in utero exposure to high rich estrogen levels. Now, the vagina itself gets thickened and is resistant to infection. In about 3 weeks after birth, this tends to wane and the vaginal wall becomes thin again. So the pH also increases to that of about 7, just like in menopausal women, it increases. The presence of the anus close to the vagina and poor perineal hygiene can lead to constant infection and infestation, and this baby girl may present with vaginal discharge. Also, continuous bedwetting, enuresis, and constant exposure of the perineum to urine can cause irritation and vaginal discharge. This can be managed, and when proper hygiene is given, the vaginal discharge may stop. However, if there is persistent vaginal discharge in a girl child, it could be a pointer to sexual abuse. You know, many some pedophiles may be around the girl child, and because the girl child cannot say what's happening to her, you may not be able to find out that this persistent vaginal discharge from sexual abuse. So if you see a persistent vaginal discharge in a girl child, it can be a pointer to sexual abuse. That baby girl should be evaluated very well. It can also be a pointer to foreign body. You know, children, they can put beads in their vagina, they can put rice, they can put stone. Something may be inside there irritating the vagina. So if you have persistent vaginal discharge in a child, consider also foreign body, presence of foreign body in that child. Candidiasis are rare. Candidiasis infection is rare in this group of individual. I mean, little children, girl children that are not up to puberty. So, except that baby has immunosuppression, whatever that will give her immunosuppression, it can lead to vaginal discharge in the child, or this baby has diabetes mellitus. So if there's suspicion of candidiasis in a girl child, that child should be evaluated for immunosuppression or even diabetes mellitus. It warrants you bringing this child to the hospital for the specialists to take care of them. When they come to the hospital, we try as much as possible to see if we can take specimen. Usually it's difficult collecting specimen from this group of individuals, children, because they may be anxious, they won't even allow you to get there. So we can use pipette, pipette is better, but we can use, if there's no pipette, you can still use swab on stick, swab stick, to get the vaginal discharge for investigation. Pipette is usually better because it causes less irritation. Now, we can even collect specimen from the anus to check for pinworm. Pinworm can cause vaginal discharge because of irritation. So it can be there irritating the vaginal wall and can cause vaginal discharge. So if there is presence of this, the baby girl is treated. Treatment depends on the cause of that vaginal discharge. I mean persistent vaginal discharge in a girl child. Now, for reproductive aged women, following puberty, when a girl child has reached puberty and she has seen her menses, that is menarche, the next thing is that reproductive tract become well estrogenized. It becomes well estrogenized because the baby girl now has normal hormones of reproduction. So the normal vaginal discharge now varies on the menstrual cycle. The early part from following menses is called the proliferative or follicular phase. Now, the later part after ovulation is called the luteal phase. Vaginal discharge in each of these cycle, in each part of this cycle, I mean the proliferative and luteal phase, they differ. Before, after menses, the vaginal discharge the young girl sees, or the reproductive aged woman sees, is affected by the estrogen. It becomes thin and clear. But after ovulation, at ovulation, you see it's stretchy and thin. After ovulation, it becomes thick and stretchy as well, but it becomes thick because of the effect of progesterone. Now, vaginal discharge, normal vaginal discharge for a woman that has normal menstrual cycle, vaginal discharge is as I explained, and is not a source of worry. However, when it becomes persistent, the color changes and it smells, looks cuddy, is a sign of infection. And the commonest is bacterial vaginosis. Bacterial vaginosis can occur in reproductive age woman, and the vaginal discharge becomes smells fishy. It has odor. The odor is fishy odor. For women that have candidiasis, you see it cuddy and itching. The woman will be coming with enough itching. For trichomonas, that's another thing that can cause vaginal discharge. Bacterial vaginosis, trichomonas vaginalis, Candida albicans. Any candida infection can give vaginal discharge. So if it's for trichomonas, you see the vaginal discharge is greenish and is also smell with itchy sensation. So when an examination is done, either by collecting the endocervical swab or high vaginal swab, this investigation in the laboratory gives different results for each of them, and this will help you to know which organism is causing which. Now, For ladies that take excessive antibiotics, you depend on antibiotics for a prolonged period of time. Let me tell you what happens. That antibiotics, remember, is working in the system. It can affect the normal flora of the vagina. The vagina is actually filled with microorganisms, but they live in equilibrium. They are balanced. Each of them stays and they cohabit with each other. That is why you have the beautiful environment in the vagina. So if you stay on a long antibiotics use, what happens is that the antibiotics selectively kills the organisms in the vagina, and you now have unbalanced ecosystem in the vagina. The normal flora system is disrupted, and Candida albicans may overgrow. Lactobacilli may overgrow depending on the one you are taking. So it's not good to take antibiotics for a very long time, and this could give you vaginal discharge as a reproductive age woman. So from whatever that is seen in the lab, the treatment depends on the organism that is isolated. The treatment depends on the organism. Sometimes, if they are not isolated, from the history you give, we'll be able to give you the required. If it's for fungal infection, if it's for bacterial infection, or even for parasitic, we'll give you the drug that will treat you for it. So vaginal discharge in a reproductive woman is not when you start um, treating yourself, doing self-medication. There are other things that can give leukorrhea. There's what we call leukorrhea, excessive vaginal discharge. Most times they are normal, and most times they are not normal. For example, in a woman that is pregnant, some of them will present with excessive vaginal discharge. We call it leukorrhea of pregnancy. Most time what we do is that if we look and there's no cause for that, we'll reassure them. We'll reassure them that they will be fine, everything will be okay. Excessive vaginal discharge can be physiological. I mean, the leukorrhea I talked about can be physiological, it can be pathological. So for physiological causes, could be pregnancy. Pregnancy can cause excessive vaginal discharge, mid-menstrual cycle, at the time of ovulation, that's what I mean, can cause excessive vaginal discharge. Then, a woman that is on combined oral contraceptive pills can have excessive vaginal discharge. Now, after sexual intercourse, some people can attest to having excessive vaginal discharge. These are physiological. But when we start talking about pathological causes, pathological causes of vaginal discharge, that is excessive vaginal discharge, that is leukorrhea, can be from foreign body, and most times they are usually offensive. It has a foul odor, foreign body, forgotten tampons, forgotten pads. During episiotomy repair, some people may put pad there and forget it. Forgotten gauze during vaginal packing, and even in fact, anything that is abnormal, anything that is not what it's supposed to be, can give vaginal discharge that is abnormal. Even some women that have sacrilege, you now see that because of the place that the mesoline tape is tied in cervical incompetence, the woman may start having irritation of the vaginal wall, and it can give the woman excessive vaginal. Now, if you have watched to this point, please subscribe to my YouTube channel. Follow me on Facebook page or at OBGYN Talks with Dr. Ada Zion. I'm also on Instagram and TikTok with the name OBGYN Talks with Dr. Ada Zion for more teaching. Please subscribe. Thank you. Now let's go on. For post-menopausal women, remember what we said. Their vaginal epithelium, their vaginal discharge is mostly basic. With the cessation of menses and then entering into menopause, estrogen level decreases. The vaginal epithelium becomes thin, and because of its nature, is prone to infection and infestation. So the cause of their excessive vaginal discharge is not different from those of reproductive vaginal discharge. Normally, a postmenopausal woman should have a dry vagina. There shouldn't be things, secretions coming out. But if you now start having vaginal discharge, someone that has stopped seeing her menses, it should cause for evaluation. That woman should be evaluated, because their cause is not different from the ones I mentioned for reproductive age women. However, malignancy, I mean things that causes cancer or cancer, should be ruled out in any woman that is postmenopausal and presenting with vaginal discharge. When you've ruled out malignancy, you can go on to evaluate for other causes, and treatment depends on what is seen. If it's malignancy, this man should be treated as such. If it's foreign body, this man should be treated as such. If you suspect that she's having irritation, whatever that it is, the treatment depends on the cause. So vaginal discharge can be normal, it can be abnormal. Abnormal causes should be evaluated, and the treatment depends on what is causing it. Thank you for watching till the end. Thank you for following me. Please share this message, comment and like. Hit the notification button if you have not done so. See you next time. I remain your consultant obstetrician gynecologist, Dr. Adazion, at OBGYN Talks with Dr. Adazion. On YouTube, Dr. Nkiruka Bridget at OBGYN Talks with Dr. Adazion. See you next time for another enriching episode of Health Talk. Thank you.